So our next session is called Our Starting Point, What is a Recovery-Ready Workplace? So I'm really pleased to introduce the lead of that panel, Rebecca Starr. Rebecca is Senior Program Director for Advocates for Human Potential, where for 11 years she has led the Access to Recovery program, enrolling thousands of people living with substance use disorders every year in a 6-month program that connects them to various recovery support services. It's my pleasure to introduce Rebecca Starr.
Hi, everyone. It's so nice to be here. And it has been inspiring to hear all of these speakers so far. I want to talk to you about this session that will focus on the topic of recovery-ready workplaces. We know from the literature out of the U.S. Department of Labor and other employer-focused research that facilitating the hiring of people in recovery from either substance use disorders or mental health disorders can help employers tap into a dedicated and reliable pool of prospective employees, as we have heard from every one of the speakers already. The National Safety Council reports that people in recovery often have a high degree of self-awareness, resilience, compassion, dedication, and understanding. And research indicates that they also have lower rates of turnover and absenteeism than the average employee. So that's the research. So how can employers start to change their policies and practices to include these applicants into their workforce? Every employer can start to adopt recovery-ready workplace policies into their mission and HR practices. Know that such policies can help reduce the costs associated with turnover, productivity losses, health service utilization, and injury or accident risk due to substance-related impairments. Also, I would bet that there are already people employed by your organization that have these issues, history of substance use disorders and mental health disorders. So adopting these practices will not only help you be able to recruit new employees, but will also help you make your workplace a more safe and comfortable place for those that are already working for you. And adopting new recovery-ready workplaces is not only an altruistic endeavor. The National Safety Council, once again, has collaborated with an independent research institution called NORC at the University of Chicago to update a tool which is called the Real Cost of Substance Use to Employers. This cost calculator is an authoritative, easy-to-use tool providing business leaders with specific information about the cost of substance use, including prescription drug use and misuse, alcohol use and misuse, opioid and heroin, as well as use of other illicit drugs and cannabis in their workplace based on size of employee base, industry, and state. You can take a look at this cost calculator for the employers out there to determine your individual and organizational costs at this website, www.norc, standing for NORC.org. This session of the symposium will leave you with a better understanding of just what a recovery-ready workplace is and concrete practices you can undertake to get you on the road to becoming such a workplace. You will hear from presenter Ramona Reno about what the conceptual framework is that serves as the foundation for recovery-ready workplaces and how she launched this initiative in Holyoke. And you will also hear from Bill Allen in a more tangible way how the MRC, the Massachusetts Rehabilitation Center, organizes their work to help employers on this path. Allow me to introduce the two presenters for this session, and then they'll take it from here. Ramona Rivera-Reno is the Executive Director of the Regional Reentry and Recovery Program of MassHire Holyoke, which is one of the state's career centers. And she's worked for more than 20 years to design, implement, and present effective employment readiness programs for justice-involved individuals and those in recovery. Bill Allen, who you've already heard from a little bit, but he's going to talk more, has worked for over 26 years at the Massachusetts Rehabilitation Commission, MRC, where he oversees employer development and engagement for 24 field offices as the Director of Statewide Job Placement Services. It is my pleasure to now introduce Ramona Rivera-Reno and Bill Allen. So Ramona, take it from here. Thank you.
Hi, everybody. Good morning. I'm very excited to be here. I'm honored that MRC asked me to present this conference. I'm one of many people whose family MRC has helped in the past. Years ago, when my husband had leg surgery and couldn't work as a carpenter anymore, MRC was able to meet with him, help him set up a career path. And not only did it, they paid for him to be a licensed building commissioner, which helped him to, find his value again in the workplace, but it also helped us to save our home, which was a very big thing. And I'll be forever grateful to Karen Whalen at MRC for her guidance and support during that difficult time. So the mission statement for a recovery-ready workforce is to create a culture of support for employers and employees who have been impacted by substance use and addiction. We learned early on during this initiative that to create a culture of support, we had to break down the stigma and have open lines of communication, whether it's substance use disorder, mental health disorders, or if it's a disability. Communication is key in being successful. So empowering others to recover out loud so others don't have to suffer in silence. This is something that I read a long time ago, and it makes sense to me, is that the more we communicate, the better we are in the workplace to have that team effort and communication so that people speak up when they need help. And that's why it's important to have that dialogue going on. Stigma, your words, your power, choose kindness. Love the person, fight the disease. Whether you feel that substance use disorder is a disease or a choice, the reality is it's humans that are being attacked by it. And we really need to support our humans as much as we can by overcoming the stigma and understanding what their value is to the workforce and how we can support them on their journey to recovery. Stigma is the biggest killer out there. Stigma kills more people than cigarettes, than heroin, than any other risk factor, because it keeps people in the shadow. It keeps people from asking for help. It keeps good people from being willing to offer help. Jerome Adams, M.D., the former U.S. Surgeon General, has wrote an article on this, and I found this to be absolutely true in the last 4 years that we worked on rolling out our Recovery Ready Workforce Initiative, that we have to open up lines of communication. And the reason why we're having so many people that are succumb to the disease is because we're not talking about enough, we're not educated enough to help them. So why should addiction matter to employees? Over 70% of people with substance use disorder are employed. On the average, each employee who recovers from SUD saves the company over $8,500. Employer-initiated treatment is more successful than treatment initiated by friends or family members, and many individuals are not able to receive the treatment they need. Your workers need your support. Why do people report not receiving substance use treatment? Lack of healthcare coverage and cannot afford the cost. Not able to find a program that offers treatment that they want. Concerns that others may have a negative opinion of them. And I have taught a lot of groups and spoken to them, and the last one, a negative opinion of them, is the biggest one that I hear them like they're ashamed of it, and they don't know how to talk about it with their loved ones or others. They're afraid to be held against them, and they just shut down. And that's something that we're hoping to overcome with our RRW initiative and working with employers. So what is a recovery-ready workplace? Acknowledges and openly addresses employees' experience with drug and alcohol misuse and the process of recovery. And they do this by communicating about the issues of reduce stigma, encourages discussion of substance use concerns and recovery success, educates employees about the disease of addiction, treatment options, and recovery support, trains employees on SUDS and stigma in the workplace, prepares supervisors to respond to substance use concerns, offers support to employees impacted by substance use in the form of policies, practices, and benefits, prioritizing safety and well-being, offers support, leave policies, and accommodation, and reevaluates hiring standards. For me, the last one, reevaluating hiring standards, stands out as a manager, because I know that I looked at many, many resumes, and if there's a big gap in their work history, I kind of tossed them aside. These last couple of years in working with people in recovery and ex-offenders, I really started looking more closely at what they did and what they have achieved. And I've overlooked I normally wouldn't call them in for an interview, but I overlooked the gap in the work history, and I found some really talented people. And I'm excited that these talented people are still with me today. So, take a second look at those resumes before you say no to yourself. What is the goal of recovery-ready workforce? Prevent exposure to unsafe conditions, such as situations that could cause a lead to a substance use disorder. One of the challenges that I've heard from many people is that a lot of the things that employers, all their activities are maybe in a bar or something around drinking alcohol and socializing in that way, and a lot of people aren't comfortable with that. And some people, just to fit in, start drinking a little bit more just to fit in, and that's an issue that we could easily take care of by offering alternative places for meetings, offering coffee, nice coffee bars that have all kinds of things on them as opposed to just a regular bar. Just thinking outside the box as you plan your employee activities can make a big help and a big difference in some employees' life. Make it easier to seek care, receive care, and maintain recovery. Those are the three things, and that all those three things can be achieved by just having open dialogue and communication and reaching out to community resources. What is the value of an RRW for employees in recovery? Work is one of the best predictors of positive outcomes for individuals with SUDS. It lowers the rate of reoccurrence, higher the rate of abstinence, less criminal activity, fewer parole violations, improves in quality of life, more successful transition from treatment to community. This is the cost calculator that Rebecca had referred to earlier. It shows you an example that the total cost for a small company of 50 is estimated at $83,692. But if it's a small firm, they can avoid that cost by having the communication, having the support mechanisms, and save over $39,000. For a larger company, over $800,000 for 500 people. And again, you see the avoided costs could be over $379,000. And so I have a slide for the city of Holyoke, which is one of our new recovery ready workforce pledge takers. Oops, here we go. So this is theirs. So the city of Holyoke has 3,000 employees. That's with police and fire and all the different wraparound things under their umbrella. The total cost is close to $3 million. And the way they figure that out is the time lost. So it's estimated that over $800,000 is lost in time. And I was reading an article, and it said that the time lost, a lot of it has to do with people who have been drinking and hungover and calling out of work. So alcohol has played a big factor in that cost. Job turnover and retraining is over $1 million, and healthcare costs are over $800,000. So you can see with employees of 3,000, significant savings if we are to be able to address this and able to address and meet people where they're at and have that communication and get the resources that they need. Communication validation equals happy humans. Spreading the word about employee worth, why communication is so key. So we talked about communication a lot because I know from speaking with many employers, they don't know how to talk about substance use disorder, or if they think someone has a mental health disorder. But what people need is just validation, talking to them. Hi, I've noticed you've been maybe looking a little stressed. Is there something I can do to help you? Just validating that you care enough about them to ask the question. Because we want our employees to be happy and healthy. We want our work environment to be happy and healthy. And communication and validation as humans is so important. This is my last slide. I have some my QR code there. You can go on that and go right to our website and see all the tools that we have there for Recovery Ready. If you have other questions, we'll have questions at the end of the segment. I'm going to, let me go. Okay, I'm turning it over to Bill. Bill, take it away.
All right, thank you so much, Rebecca and Ramona. I can't thank you enough, and I want to acknowledge both Rebecca and Ramona for their incredible, successful contributions for recovery and addiction strategies in readying the workplace. Makes our job a whole lot easier to do the skills matching. So your work is valued and appreciated, and I'm just so happy and honored to be doing this presentation with both of you. So thank you, thank you, thank you. I am today's program, when I was thinking about how we were preparing for this, something happened about a week ago. I'm reminded of the American actor and comedian Leslie Jordan, who passed away suddenly. I believe he was involved in an automobile accident just about a week ago. Leslie Jordan, if you don't know him, won an Emmy Award for his role in the popular sitcom Will and Grace. And I think Ted Wayman alluded to that. Enjoying humor and laughter. His purpose in life was really to give back to people, to be of service to others, using his laughter and his humor. And he really attributes his success, not only in his career, but also his recovery of being of service. And that often reminds me of what we collectively do here together as being of service. And his service was based in humor, in laughter. He found a meaningful purpose in keeping his audience entertained with that humor. And you heard Commissioner Wolf talk about the possibility of our purpose. And I'm going to allude to that throughout this conversation today, because that's what we do. We create an opportunity for the possibilities so that people can find their purpose. The incredible work being done by the MRC is not by itself alone. We have many vendors that we work with, our providers of services, and they are all equal to the task of what we do here at the core mission of the MRC. And there are literally hundreds of people working daily in the Commonwealth to help us with our mission to carry that forward, AHP being one of them. And I can't thank them enough for putting this symposium together, working so hard, Rebecca and the team with Fran behind the scenes, really giving us an opportunity to really take this statewide in offering our employers as well as our job seekers an opportunity and give them a chance to leverage that competitive employment situation for themselves. As you heard from my colleagues today, Joe Davis and Molly Eastman, they really did a good job setting me up for the opportunity to share with you some of our evidence-based practices we believe are going to help employers, and more importantly, the dual customer of our job seekers. The Massachusetts Rehabilitation MRC, which I will use moving forward. It's so much easier to say MRC. We work to ensure a full complement of vocational and community higher living services to empower our job seekers, to explore the possibility of their purpose while achieving economic independence through competitive, integrated employment. And that's a key factor to remember, is that they want to achieve what we all have achieved in terms of working in a competitive work environment, living that life of not only of purpose, but giving back to others. And I think Ted Wayman said it best, is I need to give back. So all of the individuals that we work with are all striving to the same values of what we do and how we do it. So some of the things I'm just going to mention today as a setup with my colleagues, and I can't thank them enough for really setting this up. We have some practices that we've learned along the way, and we continuously learn. We have some internal programs and practices. Now, I'd like to call these our intentional engagement practice, or define it as intentional engagement. And what do I mean by that? It means like We have some internal programs that are customized not only for our job seekers, but also for our employers. And we learn and listen from our employers as we learn and listen from our people we are here to serve. And one of the value added by working with the MRC and our providers is that we tap into a network of people that will help us with long-term job retention strategies. And that's invaluable, as you heard from Ramona. You know, keeping someone in the job and staying in the job can save you money in the bottom line for both profit and nonprofit organizations. So internal practices to prepare our job seekers, or our consumers, as we call them, our integrated resource team to include MRC counselors, our community resources, such as our providers. And like I mentioned, there are literally hundreds of people daily with opportunities. And we'd like to identify them, who's going to best serve our job seekers. So within our provider system, we work with the vocational rehabilitation counselor and the job placement team to identify the best provider within the community to prepare our candidates for competitive integrated employment. That's either done with our providers in tandem or internal to MRC with the job placement team. With the really foundational VR practice of the vocational rehabilitation counselor taking us along the journey of what they have discovered with their job seeker and sharing that. At that point, we would progress through understanding the job needs and understanding the expectation and environmental demands of the job. And that's really customized. You heard Joe and Molly talk about an individual plan for employment. All of the tenets of our core practices with our integrated teams come together and identify who is the best person to assist and support that individual, with our job seeking being the driving force, right? The person in charge of where they want to go and discover their own possibility of their purpose. So we also pre-screen these applicants to determine the fit for the job expectation. So we share information with our job seekers and let them make the decision, along with some guidance from the vocational rehabilitation counselor, to see if it's in fact a good fit. And I'm going to talk about that on my next external services to employers. But we give information, and information is power to our job seekers so that they can clearly understand their decision to move forward with a competitive integrated employment situation. How do we do that? So we have information from employers, and we do some internal training, such as mock interviews, resume writing. We may even do some career connections groups and bring employers to the table with us to talk about their expectations, so that they hear in real time from an employer what a day in the life might be within their own organizations. We have job clubs, so we meet weekly with our job placement team to really ascertain what jobs, what local labor market is hiring, and where are the future of jobs? Where are we going in terms of the local labor market, the regional labor market, and the statewide labor market? And we build that network together. And I'm happy to share with you, I think it was someone had mentioned that we do mock interviews. We have this database called Simplicity, whereupon our private employers come in and post their jobs, and they actually do mock interviews with our candidates to prepare them for the formal interview. I can't tell you, when you do a video mock interview, what you can learn from that and what you can glean from that, so it better prepares you to go into a formal interview. And so that brings us to our external programs, practices. They're pretty much customized business solutions from what we've learned along the way. So one of them includes our career business briefings. What does that include? So we bring our audience together, which comprises our consumers or job seekers and our business partners, our counselors, and we get together and we really drill down into a day in the life of the work, whether it be in medical sector, that we've talked about here today, whether it be in manufacturing, cybersecurity, IT, and the list goes on. So we provide these career briefings. When these job seekers come to these career briefings, they get full knowledge of what the expectations are and what the process flow would be from the business perspective. Then if we are able to do so, we design a job-driven training, whereupon we grab the proprietary information from the employer and we develop a curriculum for a specific job-driven training. Some of the most prominent ones that we currently do are our cybersecurity, Cisco-based cybersecurity programs, and we use our community vendors, Roxbury Community College, Holyoke Community College, and we design these programs for training. And at the end of that training, they're well suited to move forward in what we would put together in terms of a hiring event. So we drill down after the training, you get to meet with these employers that we've trained you to their specifications and their expectations, and you interview in real time with these specific jobs in mind at stratified levels, entry level, mid-level, and high level opportunities being offered. And at that point, if you didn't participate in one of these training programs or hiring events, we then do customized on-the-job training for the individual. So we would reach out to an employer, understand their expectations, look at the job description, and then design a specific personalized on-the-job training program with that particular employer. So what does that equate to? It means that we reimburse the employer for training to the specifications of what their requirements are. It's been uniquely successful. And then where we send people to training outside of the job-driven training and or other trainings, if they haven't had the acquired skill set, we then use our on-the-job experience or evaluation program where someone may have had the skills that they learned while going to college, while going to another training program, but they don't have the practical experience. We can then create an opportunity for what we call the OJE, on the job experience, and again, reimburse the employer. And you get to really try this opportunity out as well as the job seeker for a period of 30 days or 240 hours. And 70% of the time, if we've done our job the right way together, working with that employer, they go into long-term retention of that particular position. As I mentioned earlier, also, there's some huge tax benefits available beyond the skills, talents, and abilities that you're getting for someone to go to work for you. You now get an opportunity to tap into some federal tax credits. And I am really excited to talk about our disability employment tax credit. Again, under the leadership of Commissioner Wolf, we're deploying this tax credit for Massachusetts-based employers. So not one tax credit, but two. So this is a huge opportunity. The timing couldn't be better for employers based in Massachusetts. And one of the other components that we do is really offer diversity training, which is a windmills training, which is a national windmills training on disability etiquette and how to work and interface with individuals who happen to have a disability. This windmills training, we have all of our job placement members, as well as some of our MassHire colleagues, have been trained in this windmills training, which is free to you as an employer to really drill down and understand the ideas of the skills and abilities as it relates to someone who happens to have a disability. So in the bottom line, this tagline that I use, your success is our success. And we want to continue that success and replicate that over and over again. One of the unique opportunities that I've had to observe and help build over the past several years is our MRC employer advisory boards. We hear from you, the employer. You come to our monthly meetings, and as you can see, I won't read them all, but they're all over the Commonwealth, from Greater Boston Employer Advisory Board all the way down to the Greenfield Advisory Council. These boards offer real-time information, meaningful, purposeful information. They even give you an insight as to the labor market, where it is going, and where it may lead to more competitively based jobs within their organizations and other organizations that they may interface with on a regular basis. These boards meet monthly, some every other month, and they actually meet with our job seekers and provide critical feedback, reviewing their resumes, and they network opportunities within their own organizations and give critical feedback so that people can continue to move forward with hopefully a positive employment outcome after these board meetings. So predominantly, we are here to be of service to employers and, more importantly, to our job seekers that represent the skills that employers are looking for. We do that in a number of ways, as I mentioned, with our provider programming across the Commonwealth. It spans from Pittsfield to Provincetown and everywhere in between. So we're looking forward for building outreach for long-term retention. These strategies that I mentioned to you throughout my comments today are what creates a long-term retention strategy. So when we know more about you and we identify the right person with the right skills at the right time, we know that they stay within their job and they grow within your organization. And you've heard throughout the presentations today that someone coming from substance use disorder background, SUD, that they make that commitment combined with their support systems that are put in place for them, and with a recovery workplace, they're probably going to put more years in than me. You'll probably stay there 30 plus years for your organization. And today, that doesn't happen a whole lot. So what I can say to you, again, we are here to be of service to you, and we want your success to be our success. Thank you so much for joining us here today. There's more to come, and I want to thank you again for the opportunity to be of service.
Thank you, Bill, and thank you, Ramona. We learned a lot, but we have tons of questions. And after we answer the questions, we have Ramona and Bill answer the questions. We'll then let you out for a lunch break. But let's start first with Ramona, and I'm just going in order since Ramona presented first about recovery-ready workplaces, and then I'll ask questions of Bill about MRC in particular. So Ramona, just a quick question, is just having an employee who happens to be in recovery working for you, is that enough to call yourself a recovery-ready workplace?
No, it's not enough. You really need to think about your structure and what you can offer your the other employees or prospective new employees. So it's taking for our thing that we're doing in Massachusetts, it's taking a pledge and looking at an assessment tool to see what you offer your employees and how you can enhance that. We meet businesses where they're at, so there's no one size fits all, but just having an employee in recovery does not make you a recovery-ready workplace.
Can I follow up and ask you what kind of questions you ask employers to see if they might be considered a recovery-ready workplace?
Sure. What are their policies around substance use disorder? And do they have a flexible schedule that might be able to help and support somebody? Do they talk about the stigma around it? Do they have communication? Do they have a process in their hiring policies? For instance, I have one company who's putting the logo on their applications to let people know that they are recovery friendly and they want to hire more people in recovery. What is their commitment to communication and breaking down that stigma to the rest of the company? So we have an assessment tool that has them saying, what do you do good? You can check off as you go. Like, what do you, we have something, and we have a flexible leave act, and people that are in recovery can approach our HR or someone's not targeted, I should say. Someone is assigned to work with people in recovery to help them find the tools they need. Do they have an EAP? There's a lot of different questions to ask them to see how we can help enhance their ability to become recovery ready.
Okay, can you tell the audience here a little bit about how you launched your initiative in Massachusetts, what you did, and how it's going?
Okay, so 20 years ago, when we started working the jail, with people that are incarcerated, we found that 86% nowadays have substance use disorder. So our whole MassHire's whole goal is to connect employers with employees. And this is an untapped resource. We see 3,000 ex-offenders a year in the Hampden County Sheriff's Department facilities. And we do work readiness groups and different types of groups. And we realized quickly that we placed them in a job, but they didn't have the wraparound support they needed. You know, we're placing them, but we want to make sure they have a stronger tie to community. So we talked about what our biggest problem was in having a lapse or having a reoccurrence in substance use disorder was a problem. So we wanted to address it. I went to New Hampshire and saw that they had a really great recovery ready workforce initiative and thought we could do that at MassHire because we work with so many hundreds of employers and we work with thousands and thousands of employees as well. So we followed their template and we did we had a focus group. We hired Advocates for Potential to be our consultants to help us take it across the state. And in March, we launched it. We had Senator Velez, who's speaking later on today, and Representative Pat Duffy. We have Senator Gomez and quite a few other local legislative people that are involved. And they really want to see us taken across the state because we know that the more that we talk about it and the more that we communicate with our employers, our employees, and our community partners, the better wraparound service and support system, building up that recovery capital that's so important for people in recovery can be. So we've launched it. Currently we have 11 companies that are enrolled. And what we're doing now is, like say for the city of Holyoke, we're working with them to develop a plan on how they can use this recovery ready workforce to enhance their employees' lives. There's no like I said, there's no one size fits all. This is a wellness benefit. It's not a mandatory program that it's going to involve drug testing, all that. It's a wellness benefit. It's educating your employees and the employers about substance use disorder and identifying the local resources to help them find the support they need and help support employers if they want to, enhance their company's understanding of recovery ready workforce.
So Ramona, in your launch in one city in Massachusetts called Holyoke, have you seen any specific industries that are more receptive to becoming recovery ready than others?
No, we have a mixture of them. I know that a lot of the smaller businesses I've been approached by say, I only have like 10 or 15 people, but I know I have a couple guys in recovery. They really want to learn more about the community resources that they can give that information to their employees to support them. We have a couple of bigger manufacturers that I'm working right now. I can't say their names yet because they haven't signed a pledge, but they want to tap into this untapped workforce. They realize that their hiring practices aren't working for them. We talked to a company yesterday and they have 1,500 open positions they can't fill. So they're really trying to be creative and trying to reevaluate their hiring practice, reevaluate their the criteria for people applying that can work there. The health industry is more challenging for some and because of the CORI if they have a criminal record, but a lot of manufacturers, a lot of restaurants, the service industry, there's a high use of substance use of alcohol use actually at some of the industries, and they want to know how can we curtail that, how can we get people the help they need. So it's not one factor, it's very mixed blend right now.
And you mentioned employers taking a pledge, but you didn't really explain that. And I don't really understand that.
Oh,
Can
okay.
you talk about that, what that is?
Yeah, so the pledge is the employer takes a pledge to acknowledge, educate employees and to support them. And it's very basic pledge. I wish I don't have a copy in front of me, I should have, but it's a very basic in pledge that they agree that they committed to acknowledging that they want to break the stigma down, they want to support their employees. It's just a simple statement that we are here, we value our employees, we value our community, and we're committed to breaking down the stigma around substance use disorder and supporting our employees in the community who need the help.
Great. So someone asked if you, they're not from Massachusetts, they asked about if you could supply materials to show them what you're doing in Massachusetts to create recovery-ready workplaces. And I just wanted to point out to everyone that Ramona put in the chat already her website. And maybe Tech Tony can do that again. And everybody can go to the website and see all the materials she has, everything from the launch. It's a great website. We helped develop it at HP. And you can then also email her separately if you want more information about how she's doing this in Holyoke.
Can I say, Rebecca, that there are 30 states that now have it, and I can send out an active map. I'll look for the link, and they can click on the map, and it'll tell you exactly who's doing it and go to their website. And also, the Executive Office of Department of Labor and Workforce Development just launched a Recovery Ready Workforce Hub, and I have that link. I'll get it into the chat before the day is out, where you can click on that. They're building their toolkit, but they have a lot of great tools there. This is something that is going across the state and much needed. So you can, I'll put those two things I'll send them to Tony so she'll put in a chat in a little bit. Okay.
Okay, great. Thanks.
I'm willing to share anything that anyone wants to email. I'm willing to share whatever we have.
Great. Just for everyone's information, this Recovery Ready Workplace Initiative is not the brainchild of Ramona, although she has launched it. Actually, the Biden administration has set it as one of their top strategic initiatives for their administration. And so the ONDCP, which is the White House's arm for substance use policy, drug policy, has set advancing recovery-ready workplaces as one of their top initiatives. So it's happening all over. And as Ramona said, she can let you know which states have it and which states don't. I think one of the very first states that started this was New Hampshire, if I'm not mistaken. And so if you go on New Hampshire's government's website, you can also see what they have for their Recovery Ready Workplace Initiative and get some ideas. So attendees, audience members, if you think you work for a recovery ready workplace after hearing all that Ramona talked about, could you put that in the chat and why you think so? What makes you think that your workplace is recovery ready? It would be really interesting to see that in the chat, and then we can talk about that more. I have one more question for Ramona, and that is that some of the strategies that you described that make for a recovery-ready workplace, it seems to me that that could help all employees, not just people with substance use. Are you finding that recovery-ready workplaces are making it easier for people to be productive at work? All kinds of people with all kinds of issues?
Yeah, I think since the pandemic, we all have a little stress in our lives, right? And I know that a couple companies have really valued, so our training, we have a training team, so we have a lot of different things to offer, but some of it is just leadership styles, communication, flexibility. Their companies are asking for a lot more, not just about what is recovery. They're asking well, how do we talk to our employees about this? And, what are the laws about this? So we're actually developing and partnering with different people that can help, educate employers. But a lot of it comes down to leadership styles and helping their supervisors, understand how to approach different things. But you're right, it's all about communication. When I say we're labeling somebody in recovery, but it really is humans, and us humans, especially after these last 2 years, need a lot of grace, a lot of support in moving forward with what we want to do and in our employment things. And I see employers really trying to do that, especially now with people going remote and having to come back in the office. Flexibility is key to holding employees. I actually mentioned some job sharing to a company for 2 different people that didn't want to work a full time, and they figured out how to do that, because they're just splitting it in half, and 2 people are working a full-time job and sharing the responsibilities and working remotely and working in the office. So just being creative with how you do your work and how you train your staff is really important moving forward and meeting your hiring needs.
I actually just thought of another question that I wanted to ask you before we move on to Bill and all the questions about MRC that you spoke about and raised some questions from the audience. If the people in the audience today wanted to go back to their employers and say, I want to get on this bandwagon. I want our workplace to become recovery ready. What is one thing that they could do? That's easy, not too hard, not overwhelming, not taking a pledge, just one specific thing that they could do.
To entice their employer to sign on? Is that what you're
No, to get them on the path of becoming recovery ready.
I think they could, go to our website, and we have the one pager there that talks about how valuable it is, not only to the employer, but the employees. And just, reading that and educating themselves. The one thing is, I guess, so I keep saying communication and key as it is. So, we know word of mouth is the strongest marketing you can have. And the more they talk about it at their job, and the more they ask about it, then the more likely it is to happen. So maybe having a commitment to have that open conversation with whoever your supervisor is, and that, they may themselves be in recovery or know somebody, but really the more that we educate each other, the more that we'll be able to fight this disease and get through it.
Okay, great. Well,
If they
thank
want
you.
to reach out to me for anything, I'm happy. My email's there, happy to respond.
And again, look at the Recovery Ready Workplace website, because it can give you a lot of information as well. And Ramona is going to give the links to the DOL Recovery Ready Hub. So you can go on there. That'll describe things that employers can do to become recovery ready. You can go onto Ramona's website. You can go onto the New Hampshire website, and you can just look up recovery ready workplaces in Google, and you'll see a lot of information there as well. So thank you for introducing all of us to this notion of what is a recovery ready workplace and why it's so important and beneficial, not only for the people in recovery, but for the workplace as well, saving a lot of costs. So thank you very much.
Thank you for having me.
Now, Bill, I'm going to ask you a bunch of different questions. We have about 10 minutes, and then we'll let everybody go for lunch. So here are some of the questions. One person asked about, how do you get on an advisory board? You mentioned advisory boards at one point. How does one in the community get on one?
You can contact your local MRC office. You can contact me. My contact information is on this presentation, I believe. So if you want to contact me directly, I can hook you up with one of our advisory board representatives.
Great. Some questions about how eligibility is determined. How does one find out if they're eligible to receive MRC services?
So that's a really, really detailed question. I don't know if my colleague Joe Davis is on the call or Molly. Yeah, there she is. She can give you the details of eligibility.
Okay, great.
Sure, I'm happy to respond to that question. Right now, the MRC has, as I said during my talk, we have a brand new system in place for applications and referrals. So they will go through the MRC Connect. Insofar as how eligibility is determined, when you sign up for services, the person who's in charge of the process through the MRC Connect will ask you a series of questions, and we go by self-report. So whether it's recovery from a stroke, for mental illness, for substance use disorder, you would say, my disability is substance use disorder. At that first leg, there is no documentation that's required. We go strictly by your self-report. By the time the MRC makes some decisions, they will, they will ask you if you have any records, like if you have records. And I responded to this question in the chat because it was kind of a lengthy response. But for someone who's in recovery, you may not have like information that you could get from your doctor, but for a lot of people who are in recovery, their doctor may be aware that they've been dealing with this, and it may be documented somewhere. So they could write a short note to say, my patient is in recovery, or my patient has had substance use disorder, over whatever many years. It could be a note from your sponsor. It could be from your recovery group, like AA, NA. If you're a part of a group, someone who is the recorder or the person who facilitates the meeting, they could just write a statement to say, Joe Davis is a part of our recovery group, and they've been in good standing, or whatever it is that they want to say. If you have been in a treatment program, somebody was talking about High Point. If you were either inpatient or outpatient, you might have records for when you were there. You may have received a certificate of completion. I know many of the treatment centers that my office is affiliated with, they will, they do internal record keeping. And so if you've gone through there, they would happily send out records once you request them to us, that we could use to substantiate your eligibility. But what I really want you guys to understand about the new model of MRC eligibility determination, we are not so much stuck on records acquisition the way that we've been in the past. So this is another way that we partner with our applicants. We have the capacity to have a psychodiagnostic test done on someone who's applying for MRC services. That will give us some cogent information that we could use that could help with an eligibility determination. What we don't want is for people to hold back on accessing the great services that we provide just because maybe they don't have a paper trail. Many people who've been incarcerated, unless they participated in some type of recovery group while they were in the house of correction or in prison or in jail, they may have something to say, oh yes, they participated in a group. Something like that would be sufficient, but many people don't have a real strong paper trail. I mean, this is, it's kind of one of the nuances of recovery. So don't let that be a stumbling block to you accessing MRC services. Make the application. And if your situation is that, you've been incarcerated, or it's been years since you've been in recovery, that's a good thing. The MRC can help you obtain what you need in order to access our services. Our motto nowadays really is to leave no consumer behind. So if you feel you are in need of the types of services that the MRC provides, and you have even a small shred of documentation that can substantiate that, fill an application out, call the MRC Connect, put an online application in, and the person who's going to help shepherd you through that process, they will work with you to come up with some type of documentation to assist you in your request for MRC services. We feel just that strongly about individuals being able to access our services.
So I could just add on to that our employers can utilize our job placement staff as well, because oftentimes we do referrals from employers for people that are currently working, and because of the substance use disorder is permeating, and someone hasn't identified themselves, but they're having problems on the job, that's where our team can come in and be of value, to Joe's point, so that we can create a pipeline internal to an organization. Whether you've hired someone from us or not doesn't really matter. We want you to do that, but we're also have what I would consider a reverse referral. So an organization comes and says, I think we have some issues with some of our employees. We can come and do training and in-service of the value of self-identifying and beginning that process to come through an organization that may need employees that need some assistance.
Thank you. You know, MRC sounds fantastic. It offers so much, and they're trying to be open to engage with as many consumers as possible. There are several people in the audience that are not from Massachusetts, so they can't use MRC. What do they do? Is there an MRC in their state?
Yeah. So what I can tell you, is that I'm a part of a national employment team, the NET. It is part of the CSAB. I'm throwing a lot of acronyms out there, but it's a federal program. So every state is mandated to have a vocational rehabilitation program out there. We're connected through CSABR, which is the Council of State Administrators for Vocational Rehabilitation. I am the Massachusetts representative for the National Employment Team. So if someone is seeking assistance with their state VR, I can hook them up with Kathy West Evans, who is our executive director on the national scale.
Great. So anyone in the audience who wants to find out who their vocational rehabilitation organization is in their state can contact you or go on to a website. Do you know the name of the website?
Yeah, you can go on to the Rehabilitation Services Administration, RSA, or you can go on to CSAVR, which is the Council of State Administrators of Vocational Rehabilitation. Or you can Google vocational rehabilitation. It's probably going to drag you right into the states that offer these services. It's a federal law. It's chartered, and we have every state in the union offering vocational rehabilitation.
Great, thanks. So something specific to Massachusetts and the MRC, a question came up. Is there work being done to change the sub-minimum wage issue for people living with disabilities? I know that organizations like the Salvation Army will pay their clients or workers under minimum wage for the same work being done by their regular employees.
Joe, do you want to take this?
Sure. What this individual is referring to is what we call supported work. And I was actually in the process of responding to that question when this other piece came up about our state VR. And so supported work has been around for a really long time. It is a structure in place that allows people who are not in a place where they could obtain and retain gainful employment. The MRC, and well, first, let me back away from that to let you know that there has been a growing movement to abolish supported work. It's been gaining traction over many years, and with the basic premise being that if someone is able to work, they should have the dignity of being able to at least make a minimum wage. Supported work it's still a thing. It's not being used as much as it's been in the past, but it's still there, and there are some individuals who, in order for them to work, they go through supported employment situations, and they don't really complain about it. But I think for myself, someone who's been around for some time, I do believe that there is a value to a person being able to be paid like everybody else. I look at it as an equity and inclusion question. So
So Joe, also, I think what addresses this specifically is the WIOA law, the Workforce
Yes.
Innovation
Thank you.
Opportunity Act.
Thank you,
That law
Bill.
is actually implemented, and it's really stripping down sub-minimum wage work. So we're going to see the law be a driving force to eliminate that, what we would call back in the day enclaves, where groups of people would come
Yes.
together. We're going to upskill those individuals so that they will be able to work and get the minimum wage for whatever job they are doing. So that's a law that's been implemented. They're phasing that into a law because for the longest time we've had these enclaves which provided a valuable service for the individual. However, as Joe indicates, over time we learn. And there's always continuous improvement.
Yes.
And the law is written to support that continuous improvement. So we are heading in the right direction with sub-minimum wage. I hope that answers the question.
Yeah, it's a matter of equity, fairness, and inclusion. We cannot leave diversity out of the conversation around equity and inclusion. And for this stratified work environment where some people are down, pushed down, and tamped down and working at below minimum wage, from my perspective, it is antithetical to all of the rhetoric and the intentionality around providing a diverse and equitable workplace. So that's all I'm going to say about it. I think
we can tell you're passionate about this.
Yeah, it's been a long time coming, but at least there is, just as the work is evolving with regards to substance use and recovery, it's evolving in other areas of the disability continuum. It's been a long time coming, and I'm really glad to see these recent developments. So whoever put that question in place, I'm really glad that they did so, because it needed to be talked about in a forum such as this.
Thank you. So I have one more question, and then we'll let everybody go to lunch. I don't know who wants to answer it, Bill or Joe or Molly, but the question is, I don't understand if MRC will come out to a job site to help the employer or the employees who may be having some difficulty. Do you come to different job sites? And if so, is there a fee for that?
Absolutely. Yes, 100%. That's our job. That's exactly what we do each and every day. We have dedicated job placement specialists and employment service specialists. We interface with employers on a regular basis to understand their expectations. If someone is struggling on the job, we will come in and provide services or create that pipeline for people to access services through the MRC and or other opportunities to educate an employer to other services with our stakeholders across the Commonwealth, our vendor system, our provider system. So yes, 100. That's part of that's an essential function here at the MRC.
Great. Thank you so much, Bill, Joe, and Molly, about explaining everything that the MRC does and how audience members who don't live in Massachusetts can also avail themselves of similar, probably not exactly the same, but similar services in other states. And thank you to Ramona for giving us an introduction to what a recovery-ready workplace is and how to get information on becoming a recovery-ready workplace, how to go to your employer to suggest that they consider that. Thank you so much, everybody.